My name is Dr. Henrietta Bowden-Jones. I'm the director of the National Problem Gambling Clinic and also the director of the National Centre for Gaming Disorders. Both of these NHS services are run from within Central North West London NHS Trust. And during lockdown, I'm keen to discuss with you the sorts of things that we've been doing to be able to provide services to people with difficulties, but also talk a little bit about what we've learned from these extraordinary circumstances, how they've impacted on our ability to deliver clinical services, and indeed what sorts of things we've decided to keep with us, having learned lessons over the course of the last few months. When behavioural addictions need to be treated face-to-face, the clinic invites people to come for an assessment. The assessments last about an hour and a half or so, and we delve really deeply into the information in terms of past history, early life experiences, just as much as we do in relation to what the toxic behaviours, addictive behaviours are currently. We worried during lockdown that we might lose some of that personal connection that we establish in a face-to-face interview, particularly because although some people were happy to do Zoom assessments, others preferred telephone assessments. And I personally did most of my work, of which I did a lot during lockdown. I went back to doing majority of my work ended up being very, very clinical, key working, things that may have been times of the week that may have been more linked to administrative and more academic tasks were then clinical. And what we found was that people were absolutely fine with talking to us, despite the Zoom, despite the frequent lack of visuals in terms of the phone calls. And from a clinical perspective, I would love to share this because it was so unexpected. I have very much enjoyed sitting here in the office with my headphones on and really focusing on the verbal content, the imagery that the patients were projecting onto me, and being able to use my clinical decision making almost in a non-clouded way, not non-clouded by all the visual imagery, the meta communication that often is in the room. At the same time, when you've got someone there who may be saying one thing, but in some way distracting the conversation in other ways visually. So I have found it very, very helpful. And in terms of the therapeutic relationship that I hear about from the members of my team with their patients, we have understood Zoom to be a extremely good way of bringing groups together. I will particularly talk now in relation to gaming. The gaming patients we have are from all over the country because the centre is a national centre. And because they're quite young, it's been easier for us to bring people together in a group session than we would ever have been able to do face-to-face. And children who are hiding under duvets, literally hiding under duvets and not wanting to share their meals with their families, are actually logging on to take part in our treatment groups. So it's been a moving experience as well, being able to reach the people who we could not have reached normally for all sorts of reasons. And we've managed to create for these young people a cohesion amongst the gambling disordered young, mainly men, that we never dreamt of. And so when I then look back on these experiences and I plan the future for the two clinics that I run, the gambling clinic and the gaming clinic, I want to preserve some of the success that digital technology has allowed us to experience, both the freedom to see people at any time with no DNA rates, normally you have people who don't show up because they can't make it, they missed the train, they lost the money because they gambled it. But in this case, people are always available. So we have a full house in relation to making sure we offer treatment and people are attending, but also very much allowing people to be part of a bigger picture, a bigger group, wherever they may be, whatever their means might be in terms of not being able to reach us, and bringing them together with the Zoom experience. So we won't give that up, whatever we return to in relation to face-to-face work. I would also like to talk about behavioural addictions in lockdown. Before we knew whether we would be inundated with requests of help, we were discussing amongst ourselves in both the gaming and the gambling clinic the pros and cons of lockdown. And of course, when bookmakers shut, many of our patients ended up not wanting to gamble because all they wanted to do was to go to their bookmakers. Some, of course, turned to online gambling, and one particularly this morning I was hearing about had terrible trouble because then it was easier for him to spend more money than he was used to in relation to the bookmakers. But overall, some people benefited because without the bookmakers open, they weren't interested in anything else. They had narrowed their repertoire of gambling to a very specific thing. The other group had a different experience because in lockdown, they had more time. They weren't expected at work. They therefore had all day to indulge in online activities. And so they did. And we do have people who suffered greater losses than they would have done if they'd had their regular structured days with work routines, etc. What we found was that the referrals to the gambling and the gaming clinic were differently impacted by lockdown. The gaming referrals continued quite steadily, and we didn't see any changes. Whereas with the gambling, not only for the national problem gambling clinic that I run, but also for other national services across the country, we saw a decline in referrals. And that, of course, may have been due to all sorts of things. People might have thought, this isn't the right time to enter into new treatment when I can't even get to the clinic. Or people might have thought, I've got to think about my health, my family's health. This is not the time to worry about my gambling. I'll save it until after lockdown. Whatever the causes for the reduced numbers, these were certainly far lower. And it's only now that we have restarted treating people and properly in terms of large numbers, assessing people in large numbers and triaging them. Future directions for the clinic are very much to use all the recent experiences as learning lessons. And the first lesson learned is that people really do need to have a good moment of rest before restarting in the autumn with major workload. The teams have worked relentlessly because of the digital ability. Wherever they were working from home, we had to halve the teams and put half at home, half on site to have social distancing. But wherever they were, these NHS teams worked so hard, and people are exhausted. So the first lesson is really to make sure everyone has had a good rest, because to treat other people's mental health issues, you do have to ensure that you preserve your own well-being, and that's everyone. Every single person at the clinic needs to ensure that. But having said that, then lessons learned. will be very much about trusting different methods to reach patients and to allow people to connect with us in a way that never before we had done. I would now look back and say that we were quite old-fashioned in the way we applied our outreach techniques, and I do think that this new way of working with Zoom and returning even to working on the phone for people who don't want to do Zoom will allow us to work faster, work more efficiently, and allow people to reach us who in the past may have been put off. Particularly, I'm thinking of parents who work with children who are young enough not to be able to come here themselves. And that was always going to be an issue. We were always going to deal with it in some way, but now we can be very positive about positive outcomes in terms of retaining people in treatment using Zoom, either on a one-to-one basis or on a group basis.